Johanna Gustafsson is a very familiar speaker in AC contest and also formally in youth context and conferences, and we have had the opportunity to hear her thoughts in many occasions, and I personally as well. And this time she will tell about supported employment for men and women with disabilities and a gender perspective in the supported employment process and its outcomes. And you are working at the moment in Örebro University, and you are working there as a senior lecturer. So Johanna, välkommen, welcome, and the floor is yours.
Thank you so much, and thank you for the nice words as well. So, I will talk about a gender perspective on support employment process and its outcomes. And it was a project that ran between 2018 to 2022, and it was funded by the Swedish Council for Health, Working Life and Welfare. And this was a doctoral project where we eventually got Ingrid Witte became a PhD in disability research, and of course it should be her presenting this. This is what she lived with for these years, but she couldn't make it today, so then I am a standby in this. But I had this the opportunity to be her supervisor and also the project leader, so I was in every part of these studies as well, together with Thomas Strandberg as well. So, and if you want to look into her dissertation, it's this is a link to it that you can use later on if you want. And these are the 4 studies that came out of it. 3 of them are published and 1 is still in review. So I will. So why is it a need to study gender in support employment? Yeah, we have some starting points for this project. Women and men have the same right to employment. If we look at the conventional right for people with disabilities for this target group, but women with disabilities are to an even lower extent part of the labor market than men with disabilities. And even so, if in our countries, in other countries that are gender equal in participation and in working life, of course there are differences in other countries, but there is no excuse for Sweden, for example, to have this gender equal labor market. And if you look into via vocational rehabilitation and support employment, it's kind of unclear whether women are disadvantaged in vocational rehabilitation or if men are disadvantaged in vocational rehabilitation, as most of the studies do not problemize gender at all. It's mentioned sometimes, but not problemized. And also when we look at support employment studies, if we, for example, we started with this review that came from Folkehelseinstituttet in Norway that looked at employment rate in support employment and IPS. And it was shown that I was to report on that to our in Sweden. I couldn't find any results about sex, if men and women were both advantaged, but for in this in support employment IPS, because there were no gender or sex differences reported on result level or outcome level. It was just on the population level, that it was both men and women that was part of the studies, but not what their outcomes were. And even so, if we look at the how many men and women that was in the population that got support employment or IPS in these studies, there were many more men in the population than women. So really, it would be hard to tell if women was have the same outcome as men from what's been reported. And the third thing that was really made us do this application for this project, this was a Swedish RCT, randomized controlled trial of 3 VR interventions. It was support employment that was given by the Swedish SIUS the division at the Public Employment Services, and it was case management, and it was a case management that was made a bit more VR-like, because they have the goal to give VR services, not just help and support in getting a better life, but also getting a working life. So it was much more focused on working life than ordinary case management is. And also services as usual, that was a mapping service that they have as at the Public Employment Services in cooperation with the Social Insurance Agency, that they have they meet individual and plan for rehabilitation, vocational rehabilitation, and also execute. You can be on measures, for example, given by the Public Employment Service and so on. So you can get supported employment in each of this in some way, but they have a bit different characteristics. And it was over 1,000 young adults with disability. Pension in Sweden is called activity allowance instead. And it was shown in that support employment was, as supposed, the most effective after 15 months, but only for men. The women get the outcomes were alike in all of these 3 interventions for women. So it doesn't matter if they got support employment, case management, or service as usual. There, I think it was 18% or something that got into employment. And for support employment, it was men that gained from it. This was about 27%. Then this was the starting point. Then it came another study for some years ago that showed after some more time in the interventions, there was less gender differences in support employment. So it could be interpreted that it took some more time for women to equal with men in the outcome, though. But that didn't know when we started this project. So, but our questions then were, gender differences has been observed, because it had, in that there are no clear explanations on why they occur. They seem to be there, but nobody knows why, or at least not have written on why. And it is also quite kind of problematic from a gender equality view if you have an absence of gender perspective when you use support employment, for example, because it's maybe that the efforts are being less efficient, and they do not have the optimal efficiency for both men and women with disabilities. Maybe if we look at gender specific factors, for example, we could higher the outcome rate for support employment in total if women with disabilities got better chances, because that's what we saw, that women was a bit disadvantaged, at least in this RCT study. So the project aim was to explore the influence on gender on access, process, and outcomes in support employment for men and women with psychiatric, neuropsychiatric, and intellectual disabilities. And why we chose these disability types was mainly because the funders wanted that, but also because if you look at IPS, it was invented for participants with psychiatric disabilities, And also there has been a lot of people diagnosed with neuropsychiatric disabilities or developmental disabilities, depending on what you call them in different countries, in the last 20 years. So it became a kind of a large target group for support employment. And intellectual disabilities, yes, that's where it all started with support employment. So we thought that was kind of okay to have these target groups to look especially on, even if it would be really interesting to look at others as well. So, and our starting point is that we think of gender as constructed. And Harding, for example, she in a framework, there are 3 aspects of gender: the gender structure, or you can say the division of labor by gender, and the gender symbolism, that societies organize both the what you call the natural or the physical world and the social world in gendered meanings, that we have words and expressions, concepts are gendered, and they have gendered meanings that means different for example, men and women. And now I just talk about men and women. I totally recognize that there are more gender than men and women. But in our study, we choose to look at men and women because there were so few that could be recognized, for example, in the studies that have been done. That was often it's mentioned at the third gender or other genders that you can tick in, and there are just a few people that tick in these boxes in the study. So you can't, when you look at the quantitative data, there is really hard to do something with so few observations, for example. So that is why we choose to have this dual model of gender, although there is also a lack in our study that we have this. And the third aspect of gender is the individual gender, that is what you see yourself as I say. So, and for gender symbolism, I do not think we have that it's more and more recognized that other genders are as well in that, but it still is less than the division in men and women in gender. So, and we also have another theoretical framework by John Ecker that we used, gender organizations. And Ecker, she had this framework that there are three different kinds of organizations or processes that really matter in organizations. First, it's a gender-related division of men and women in work, and this is the division. There is it influence everything in work. It influences how you're allowed to behave, the environment, how much power you have. There is really a hard kind of division in that sense, and what is especially important for our studies, as I will tell you more about, is the gender-related division on the labor market in paid work and in family work, unpaid work, for example, that really influence both opportunities for men and women to be in working life. And Ecker also talk about the construction of symbols and images that explain and express the gender-related division. We have, like, this is the concept of masculinity, for example. It's often associated with some kind of work, for example, technical skills. It's not that uncommon that if there are problems with the computers, we turn to a man to ask, could you help me? And also femininity with like caring skills or something like that, or social skills that we turn to a woman if we are going to celebrate a birthday at work, for example, and need to plan that and so on. So there are gender divisions by the symbols and images of men and women as well. And also a further process, this is the interactions between us that are in a workplace, for example, or in another organization between same sex and different sex, and how these interactions maintain this gender-related division. For example, that we can see if we look at the VR and also in other in the labor market in total, that men are seen as the actors, the breadwinners, those who should work in some way, while women are seen as they should provide emotional support and that kind, and it's interact with all of the others as well. And these three processes to support the creation of your individual identity in relation to gender. Example of what occupation that may be suitable and so on. So it's kind of create the space that you have to live in some way. Of course, it could be those who really do otherwise than me in this, but in general, I would say that we are really influenced by this kind of societal view on gender. So what we did was we did a literature review to start with, what's been reported on intersecting statuses of people with psychiatric, neuropsychiatric, or intellectual disability. And the interacting statuses, it was the type of diagnosis, it was sex, it was race or ethnicity, it was age and level of education and previous work history. So we didn't just want to look at sex or gender, because then we ended up with too few articles to do something about in a literature review. And when we searched it, we ended up with 53 articles that reported on employment rate in supported employment, or IPS, with any of these statuses. So, and you maybe thought that it was more than that. Of course, there are much more. We had a lot of articles. We read like it was 4,500 from the beginning, and I think we read like 300 full text. The problem was that this statuses was reported when they reported on the population, but they were not reported on or aggravated in the results. So we couldn't see any outcomes for these statuses. So that's it. Only 53 articles was reporting on the statuses in the outcomes. And 41 of these was on populations of persons with different type of psychiatric disabilities. It was studies about the IPS, basically. And of the 38 studies of these that report on sex distribution, 21 have a significantly higher proportion of men than women in the study sample. And in one of the studies, it was like 90% men in the population. So it was really a few women, and this was the trend for a lot of studies. And no study had a significantly higher proportion of women included. And there were also variation in the definition of employment rate that made it very difficult to compare the studies. So employment rate isn't something that you become employed or not. It could be a lot of variances in that. So we had a really hard time to define what employment rate should be. And what we saw that was in the majority of the included articles, these intersecting statuses did not affect the employment rate for people in the supported employment, including IPS intervention. But this was also due to kind of a small population problem, that there were two small populations. I mean, if there are 50 persons you look upon, then you won't get any results on that. You can see results on intersecting statuses because there are two small populations. So this is also a problem. So I would say what we found was that we need to report more on, for example, gender and so on when we do that kind of studies. We also did an interview study with employment specialists in different organizations in Sweden. It was a focus group interview studies. We did 12 focus groups to explore employment specialists' social representations of gender in relation to work and disability, and how these social representations influence their work in the VR process. And the social representation, this is a theoretical framework that talk about, we have these social representations when we think of what's happening in a world, when we talk about what's happening in a world. It is a frame for our interpretation of what we experience, and it also influences how we view ourselves and our world around us. For example, a social representations of a bird, for example, may be that this is has this you can fly as a bird. There are tweets, a bird tweets, and they have this. I don't remember what's the name, nebb in Swedish, for example. This could be a social representation, one that we. This is a common language, common understanding of one thing. So we wanted to look at this. What was the representation of work and disability? And we found 5 themes there that the employment specialists they're about their representations of this. And they had the first theme was that there are differences in personal and health factors among participants in vocational rehabilitation. Where women were seen as more compliant than men, and also more cautious and insecure. And women were also seen as having more mental unhealth or mental illness, that they were more affected by that than men in general. That was their representation of the woman or men they met when they worked in VR. And also that men and women wanted different things from employment, that men wanted a better income, while women wanted more fulfillment or having a meaningful employment or meaningful activity in that sense. The other theme was the gender norms in society influencing vocational rehabilitation. And this was about the societal expectation of men as breadwinners, and that men should provide for family, while women should provide for and provide should to be more familiar or having the responsibility for their family, and so on. And they also talk about the societal expectation that and gender norms in society that also influence, like for example, that there were norms of behavior, that boys with unusual behavior or unexpected behavior by societal norms get noticed earlier than girls in school, for example, and also get diagnosis earlier, while women or girls in school, they masked more and got their diagnosis later on in life and so on. So it's this was kind of gender norms that influenced also in VR who come to vocational rehabilitation and so on. The third team that the employment specialists talked about this was the energy intensive environmental issues influencing VR. Where women tend to live in more energy intensive environment in family, for example, have the responsibility for family, and that was an extra burden that made it difficult to focus on work. And there was also this female typical work like care and education that may be more energy intensive due to more communication and caring than typical male work such as construction and so on. And the fourth theme was the employment specialist being more careful about towards women. For example, if they saw them as more mentally unstable and so on, and more pushy about towards men in these gender-specific interactions. And also that was kind of hard to be gender sensitive when we work individually, as it was difficult to detect gender bias when we worked with only a few participants that couldn't see this gendered path in some way. And the fourth theme was the gender path through the welfare system, where women and men tend to be in different parts of the welfare system, where women was more in health or health care services and men more in special education services or employment services. So they were also coming from different remittents to SCA. So this was also something that influenced the work with participants a bit. And we also did a study on the participants where we explore their experience of participating in SC intervention. And they, in general, men and women noted the same enablers and barriers. They value a trustful relationship with the employment specialist, supportive workplace, and that they got the personal growth from being in SC. But there were also some differences that we saw. That the women experienced that the access to the VR service has been more of a random procedure, depending on mere chance. They got meeting somebody who referred them to it, which was not a structural approach to it. It was mere a chance that you meet somebody who refer you. And the woman also talk about the appreciative when the employment specialist placed reasonable demands and challenges them to progress. And also they appreciated the opportunity for a slow start in support employment to progress into more demanding activities. And the woman was also more inclined to receive more of a whole life support, which was not related solely to workplace support. It was also about like handling authorities and so on. So the rapid job principle that is one of SC principles are not that did not seem that effective on women in that sense. They wanted something else in support employment. And I skipped the last one because I do not have the time. I rather sum up a bit. But the gender, to sum up, there were two things that we really want to highlight from this project. There seemed to be a gendered path into support employment where more men than women receive support employment or IPS services. And this could be that there are more men in some of the disability categories that usually receive support employment. For example, neuropsychiatric has been traditionally been more men than women that are given the diagnosis, but this has changed now. So in the future, there will certainly be differences in that. But we also, other gender path is the gender path through the vocational rehabilitation, where what Acker called the gender-coded suitable behavior is something that we need to be aware of as professionals, that we expect maybe different things from women and men, and also see different things in the same behavior, for example, where men and women are interpreted differently. when men talk about them being a little nervous, we maybe interpret it as something else than women talk about being a little nervous, for example, and so on. We interpret what people say and how they behave differently. But also we interpret their behaviors as different diagnoses. For example, autism and mental health diagnoses, they could be the same. They have the same consequences in some way, but you diagnose men and women differently, and also they receive different services because more often they are remittent from for the diagnosis into different services. And if women are seen as mentally unstable or insecure or something that we have our representations of, they're also more likely to be treated cautious and also seen as vulnerable as a group and as an individual, because this is a social representation. And these relations between an employment specialist and the participant may also uphold both general societal representation and more disability or professional specific representations of gender and disability. And we also want to highlight that gender and disability intersects a lot. As for example, Camilla talked about the invisible work, the energy it takes to live with disabilities. We also see this in our study, that women may have a higher cognitive load because they may have high support needs in combination with a more strenuous family situation that they are expected to do both paid work or rehabilitation measures that could be equal to paid work in intensity and so on, and combine this with this unpaid work that they do in this more strenuous family situation, alongside with their own invisible work as a person with disability. And maybe there is by the need, or say the need is more whole life approach to sport than men. So that was what I wanted to share.
Thank you very much, Johanna.